Your heart is doing something right now that you cannot feel. It is not pain, it is not pressure, it is not the racing pulse you would notice during stress. It is something much quieter and much more dangerous. Every single beat your heart makes today is using a little bit more energy than it should. Every breath you take when you walk up the stairs is asking your lungs to work a little harder than they did 5 years ago. And that quiet extra effort, repeated thousands of times a day, is the earliest signal that something inside your chest is starting to fail. Heart failure is the most misunderstood diagnosis in modern medicine. People hear the word failure and they think of a heart attack. They think of someone clutching their chest and collapsing. But that is not how the heart usually fails. The heart fails slowly. It fails over years. It fails so gradually that by the time most people realize something is wrong, their heart muscle has already lost a huge amount of its pumping power, usually in the form of a hospital admission, a sudden inability to breathe at night, or a swollen pair of legs that will not go down. The problem is that for decades, we have been told to watch for chest pain, watch for left arm tingling, watch for crushing pressure. Except those signs belong to a heart attack, which is a completely different event. What we are now understanding is that the heart sends out a much earlier warning signal, one that has nothing to do with pain at all, and most people, including many doctors, are still missing it. That signal is breathlessness on mild effort, and it is being ignored every single day in homes, GP surgeries, and emergency departments across the world. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years working in the A&E, I have seen what happens when preventable heart disease is not prevented in time. I have stood at the bedside of people who told me just weeks earlier that they were a bit tired lately or a bit out of breath when they walked the dog. And my goal now is to help people catch this signal before it lands them in a hospital bed and to live longer, healthier lives in the homes they love. If you are watching this video, you are probably worried about your heart or worried about someone you love. And I just want to take a few seconds here to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research, to help you protect your heart and avoid the diseases I see in the emergency department every single day. And all I ask in return is that you give this channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time or you have not learned something new, then feel free to unsubscribe. No hard feelings. But if you give me your time and your attention, I will give you everything I have learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you. And let's continue with the video. So before we talk about the warning sign itself, we need to understand what your heart is actually doing every second of every day. Because once you understand the job of the heart, the warning sign starts to make complete sense. Your heart is essentially a muscle pump, and it has only one job. It has to push enough blood with enough force to deliver oxygen to every cell in your body. That is it. The whole system depends on three things working together. The first is the strength of the muscle itself, which is how hard the heart can squeeze with each beat. The second is the filling capacity, which is how well the heart relaxes between beats so it can fill back up with blood. The third is the rhythm, which is the electrical signal that tells the muscle when to contract. Now, if any one of these three starts to weaken, the heart begins to lose efficiency. And here is where it gets really interesting. The body does not just give up when this happens. It compensates. It works around the problem. It increases the heart rate slightly. It tightens the blood vessels to keep pressure up. It holds on to a little extra fluid to keep the volume up. For months, sometimes even years, this compensation is so smooth that the person feels almost normal. They might feel a bit tired, a bit slower than they used to be. They might blame it on age or on a busy week or on poor sleep. That is the silent phase of heart failure. And it is the phase where everything could still be reversed if it was caught. What becomes clear when you see the system this way is that the heart does not suddenly stop working. It is more like a delivery truck that quietly loses one tire, then another, then another. The truck keeps moving. The driver keeps driving. But the engine is working twice as hard to do the same job. And eventually something has to give. Now the question is, what is the very first sign that the body has started compensating? What is the earliest crack in the system that you, sitting at home, can actually notice? To answer that, we need to understand what happens to your lungs when your heart starts to weaken. Because the lungs and the heart are not separate organs. They are partners. Blood flows from the right side of your heart into your lungs, picks up oxygen, comes back to the left side of your heart, and then gets pumped out to the rest of your body. It is a closed loop. So when the left side of the heart starts to struggle, the blood does not move forward as easily. It begins to back up just slightly into the lungs. You will not see this on a scan in the early stages. You will not feel it as pain, but you will feel it as one specific symptom that almost every person with early heart failure describes in the same way. They feel a little more out of breath than they used to, not gasping, not wheezing, just slightly winded after climbing the stairs they have climbed for 30 years, slightly puffed after walking from the car park to the supermarket, slightly short of breath when they bend over to tie their shoelaces. And here is the part that makes this so dangerous. Most people do not call this a symptom. They call it getting older. They call it being unfit. They call it carrying a few extra pounds. And so they ignore it for months, sometimes for years. So let me name this warning sign explicitly, because up to this point we have been building the physiological case, but I want to make sure this lands in practical terms. The number one warning sign that your heart is starting to fail, the sign that shows up earliest, the sign that almost every cardiologist will tell you to take seriously, is shortness of breath on mild physical effort. Not sudden breathlessness, not gasping, not the kind of breathlessness you get from a chest infection. It is the slow creeping kind, the kind that shows up doing things you used to do without thinking. That is the signal. That is the alarm bell. And it is being ignored in millions of homes right now. That's it. That is the early sign that your heart muscle is no longer keeping up with the demand your body is placing on it. And in the world of cardiology, this symptom even has a name. It is called dyspnea on exertion, and it is one of the strongest early predictors of future heart failure that we have. Now, this shows up in a few different ways. The most obvious is breathlessness when climbing stairs. You used to get to the top of the stairs and feel completely fine. Now you find yourself pausing on the landing, taking a couple of extra breaths before continuing. You do not collapse. You do not panic. You just need a few seconds. Most people brush this off, but it is one of the clearest signs that the heart is no longer pumping enough blood forward to meet the oxygen demand of working muscles. The less obvious version is breathlessness when lying flat in bed. You go to sleep and find yourself adding an extra pillow because lying flat makes you feel like you cannot quite get a full breath. This happens because when you lie down, gravity is no longer helping to keep fluid out of your lungs. The fluid that has been quietly building up because your heart cannot pump it forward fast enough now spreads more evenly across both lungs. People do not link this to their heart at all. They think they have allergies, or a bad mattress, or a stuffy room. They sleep propped up for years without ever asking why. Then there is the category of breathlessness during ordinary daily activities. Walking from the bedroom to the bathroom, carrying shopping bags from the car, pushing a Hoover across the carpet, bending down to put on socks. None of these are demanding tasks. In fact, they are the tasks people have done for decades without thinking. But suddenly they leave you slightly out of breath. The body is whispering. And most people do not hear it because they are not expecting whispers. They are expecting chest pain. Nighttime breathlessness is particularly worrying because it tells us the compensation is starting to fail even at rest. When the heart cannot keep up while you are asleep, it means the system is running out of room to absorb extra strain. Some people wake up suddenly in the middle of the night, feeling like they need to sit upright to catch their breath. This has a clinical name too. It is called paroxysmal nocturnal dyspnea, and when it shows up, the heart is already in trouble. Now, I want to be very direct with you here. None of this is your fault. Heart failure does not creep in because you have been lazy or because you have failed at some moral level to take care of yourself. It creeps in because modern life was engineered against your biology. The food system was built to be cheap and addictive, not nourishing. The work culture was built to keep you sitting for 10 hours a day. The medical advice you were given for decades focused on cholesterol numbers and salt intake while ignoring the metabolic and inflammatory drivers that quietly damage the heart muscle year after year. The system failed to teach you the early signals. The system failed to tell you that breathlessness, the kind you laughed off, was the first crack in the dam. So what is the solution? Well, I want to frame this very carefully because I am not advocating for extreme exercise. I am not suggesting you need to start running marathons in your 60s. And I am certainly not suggesting that any single approach is right for everyone. What I am saying is that if you want to protect your heart and catch problems early, then you need to do 3 simple things consistently. And each of these works through the exact mechanism we just talked about. The first thing is to track your breath honestly. This sounds simple, but it is the single most powerful thing you can do. Pick a flight of stairs you climb often. Pick a walk you do regularly. And pay attention to how you feel at the top or at the end. Are you breathing harder than you were 6 months ago? A year ago? If the answer is yes, do not brush it off. Do not blame your age. Do not blame the weather. Write it down and tell your GP at your next appointment. Research published in the European Heart Journal has shown that patients who reported gradual breathlessness to their doctor were diagnosed with early heart failure on average 2 years earlier than patients who waited for severe symptoms. 2 years earlier means 2 years of treatment, 2 years of muscle preservation, and often a completely different long-term outcome. The second thing is to move your body daily, but in a gentle and sustainable way. Walking for 30 to 40 minutes a day at a comfortable pace is one of the most powerful heart protective interventions we have. When you walk, your heart receives a small, repeated, manageable challenge. Over time, the heart muscle adapts and becomes more efficient. The blood vessels lining the inside of your arteries release more nitric oxide, which is the natural chemical that keeps vessels flexible and lowers the workload on the heart. This is not about burning calories. This is about keeping the engine well-tuned. Even 10-minute walks after meals 3 times a day have been shown in clinical research to improve heart efficiency in older adults. The third thing is to clean up the inputs that quietly damage your heart muscle every day. And the biggest one by far is ultra-processed food. Ultra-processed food drives chronic inflammation. Inflammation damages the small blood vessels feeding the heart muscle. Damaged blood vessels mean a heart that has to work harder to get the same amount of oxygen. Replace ultra-processed food, even partially, with whole food, and the inflammatory load on your heart drops within weeks. You do not need a special diet. You do not need to eliminate entire food groups. You just need to eat food that looks like food. Vegetables, fruits, eggs, fish, meat, beans, nuts, simple grains. That is the heart's preferred fuel. Now, I want to be very clear that I am not suggesting anyone stop taking their medication without talking to their doctor. It is not safe, and it is not something I would ever recommend. But what I am saying is that medication and lifestyle are not opposites. They work better together. And if you have been on heart medication for a while and you are still feeling more breathless than you used to, then it is worth asking whether the underlying drivers, like inflammation, processed food, and inactivity, might be the missing piece of the puzzle. Medication treats the symptom. Lifestyle treats the cause. You need both. Let me bring this back to what I see clinically because I think it really helps to ground the physiology in actual patient outcomes. I have had patients come through the emergency department with severe heart failure who, when we look back through their notes, had been mentioning breathlessness to their doctors for 2 or even 3 years. They were told it was anxiety. They were told it was being overweight. They were told it was just getting older. And by the time anyone took it seriously, their heart muscle was already significantly weaker than it should have been at their age. What is remarkable is how quickly things can change when this signal is caught early. I have seen patients who started walking 30 minutes a day, cleaned up their diet, and worked with their doctor to optimize their medication, and within 6 months, their breathlessness reduced significantly. Their scans started showing measurable improvements in heart function. That is not a placebo effect. That is the heart muscle finally being given the conditions it needs to recover and adapt. Heart failure is not just a number on a hospital chart. It is a direct measure of how independent you will remain as you age. It determines whether you will play with your grandchildren without sitting down every 5 minutes. It determines whether you will travel in your 70s or whether you will be tied to your living room because walking to the corner shop leaves you breathless. It determines whether you will live the next 20 years in your own home or in a care setting because your body simply cannot keep up anymore. What is less well appreciated is that the same mechanisms driving early heart failure, chronic inflammation, poor metabolic health, sedentary living, and ultra-processed diets are the exact same mechanisms driving dementia, kidney disease, and the loss of muscle that leads to falls. These are not separate conditions that happen to occur together by coincidence. They are different manifestations of the same underlying breakdown in how the modern human body is treated. When you protect your heart, you are not just protecting your heart, you are reducing your risk of essentially every major chronic disease that shortens lifespan and degrades quality of life as you age. That is the real prize here. So let me bring this full circle. Your heart does not fail because you are lazy. It does not fail because you have done something wrong. It fails when the early warning signs, especially gradual breathlessness on mild effort, are missed, dismissed, or blamed on age for years on end. The solution is not extreme exercise or a perfect diet. It is simple awareness. Pay attention to your breath. Move your body every day in a way you can sustain. Eat food that comes from the earth, not from a factory. Talk to your doctor the moment you notice something has changed. Those 4 small habits, repeated consistently, are more protective than almost any medication we have. And finally, just to end, please subscribe to the channel if you found this useful to help me reach more people like you.